Hello, my name is Dr. Gerald Tobias. As a veterinarian, I have seen adopted dogs and cats that were older than the new owners were told. In extreme cases, some recently adopted pets were already elderly. Determining the approximate age of dogs and cats is difficult. The long-used dental aging technique is most accurate when used to identify dogs who are immature or 1 to 3 years old. In dogs over 4 years of age, the eye lens method is more accurate, but precision to the correct year is not possible. We are limited to placing dogs in age groups. In cats under 4, the dental method has very limited use. For cats over 4, only the eye lens technique can place them in correct age groups. I developed the eye lens method in the 1980s. I have trained people with no medical background to use this technique. First, let's look at the key points of this video. While shining a pen light into the eye of a dog or cat, if you see these pinpoint reflections, the animal is under 4 years of age. This one and this one. We will ignore this one. If you see one pinpoint reflection and the other is 1 to 2 millimeters in size, the animal is about 5.5. If this is pinpoint and this one is slightly enlarged, the animal is 5.5. If you see one reflection that is enlarged and the other one is even larger yet, like we have here, this one and this one, the animal is about 7.5. If you see even larger reflections, you go to a chart that I will direct you to with your millimeter measurements to get the animal's approximate age. Notice this drawing of the eye. The clear cornea here, with the colored iris underneath it, with its central pupil, and then a clear lens underneath it. The lens does not look clear because you see right through it to the retina. In these next frames, I am shining a pen light into a glass bulb. Imagine this glass is the lens of a dog or cat that is under 4 years of age. 2 reflections are seen inside the lens, one from the lens's front surface and one from its back surface. The anterior reflection follows the pen light's movement. It moves right when the pen light moves right, but the posterior reflection does the reverse. It moves left. That is how we will know which reflection we are seeing. The reflections from this glass are large. The small lenses in a young dog or cat produce reflections that are pinpoint in size, as you saw in the first picture that I displayed. To make reading the paper that I will be directing you to more understandable, I need to show you how the lens develops 2 more reflections for a total of 4. All lenses over a lifetime slowly develop a clear half-inch diameter sized area called a nucleus in their centers. Imagine the lens as if it were an egg with an invisible clear yolk inside. This is an enlarged lens with a cutout showing the nucleus inside. Here we show the inner yolk or nucleus going from very clear, less clear, and getting progressively darker. As it progresses, it starts producing its own 2 reflections. First, one from the back surface, and then one from the front surface. The back surface reflection happens soon after 4 years of age. The one from the front surface comes visible after 7 years of age. So now we have 4 reflections inside the lens. In the next few frames, I have put a small glass bulb inside the larger one, and you get a very approximate idea how the 4 reflections appear. In a dog or cat's lens, the reflections are much closer together, but the movements are the same. But these two new enlarging nuclear reflections will soon obscure your view of the original two pinpoint ones, and we end up having only two reflections to evaluate in late, middle, and older age dogs and cats. To see the lens reflections, we must look through the cornea and the pupil with a bright medical pen light. Enlarging the pupil by darkening the room is essential. The cornea itself produces an additional single reflection that has nothing to do with eye lens aging. You can tell its reflection from the lens reflections because it is not inside of the lens, but just behind the cornea, and it is large and bright, as you saw in the first two pictures. If one or both reflections in the lens are enlarged, determine their approximate size in millimeters. Holding a short millimeter ruler or a card with circles on it from pinpoint to 4 millimeters next to the eye for comparison is very helpful. Here is the millimeter ruler. Here are the dots getting larger till we get to 4 millimeters. Since cat reflections enlarge at slightly slower rates, you will compare your measurements to a dog chart or a cat chart that you can find in my paper. Seeing the initial enlargement of the posterior reflection is the most important part of eye lens aging. Early changes are faint. It requires good vision or magnification. Hold the pen light about 8 inches from the eye and move it back and forth 2 inches to either side. This moves the reflections, so they are more noticeable. Moving the pen light excessively to either side or too close to the eye or using a weak pen light can cause false readings. As an animal ages, the lens loses clarity and takes on an antique glass appearance followed by a light blue-gray color that becomes more intense. Charting these clarity and color changes also aids in determining an animal's correct age. The charts include these changes, and I developed this model to help interpret the color changes. I also wanted to point out these charts are to be found in the paper that I will direct you to. Medical pen lights can be found on the internet or in medical supply stores. These pupil sizes on this medical pen light, meant for humans, are too large for dog and cat use. Large flashlights are not usable. Laser lights can injure the retina. It is essential to start with a calm and gentle pet under 3 years of age so you can identify pinpoint reflections. For safety, use proper restraint when examining animals. An animal can get frightened when a light is shined into its eyes in a darkened room. If you wear glasses, make sure you are looking through the near vision part of the glasses. Thank you very much.